Are you okay? Yeah, it's so funny, right?
It's hilarious.
Yeah. Hi guys, how are you?
Welcome back. I am in the hospital currently for a stroke. So we're gonna vlog the process of getting medication.
Yeah, it's kind of sad, but we really want to figure out why she's so sick. So
And share with all of you.
yeah, let's see. How do you feel the waiting nurse?
Oh, I'm a little bit nervous just because I don't know what to expect.
Oh, she's
Come in.
coming in. Okay. Hi.
Hello, my name's Samantha. I'll be your nurse today. Who do you have with you today, Emily?
This is my sister, Jesus.
Yeah,
Nice
hello.
to meet you.
Yeah.
She's also a nursing student.
Mhm.
Cool.
But before that one, is it okay we record what you talk to her?
Yes, of course.
Okay.
Yes.
And then is that okay? Can I record your face too?
Yes.
Oh,
Yes.
thank you so much. Can you say hi?
Hello.
Yes.
My name's Samantha, and I'll be the nurse today. Emily is here for her prescription of Warfarin. She was diagnosed with a deep vein thrombosis, and that makes the components in your blood stick together, and so she's going to be taking Warfarin to help thin her blood.
Wow. How you feel about that?
I'm a little scared. I don't think I want to take it.
Yeah.
I completely understand that you might be scared. Today we will be going over any questions you might have to make sure that you're comfortable before taking it. This drug is an anticoagulant, which means that it thins your blood and it will prevent your risk of heart attack and stroke, but there's still a small chance that that could occur.
Wait. What do you mean she need to take a Warfarin? As I know, Warfarin is really not good with the other medications, so she cannot take it. And it's really like a high risk with the blood clot. Is that okay?
Yeah, great question. So warfarin does have many drug interactions because it is metabolized through the liver, where lots of other drugs are metabolized as well. But the drug is used to thin the blood, so it shouldn't increase your risk of blood clots.
Okay. Then is it okay, like she taking like any food or like any things like supplements, or when it will be the best time she take that one?
Yeah, so you want to choose a time that is easy for you to remember to take it, and it's recommended that you take this drug at the same time each day so that you don't forget any dosages or anything like that. You can take the whole tablet or crush it, and you can take it with food or without.
What about how much I have to take each day? I don't want to be taking like a million pills a day.
Yeah. So your prescription is going to be 2 milligrams per day for the first 2 days, and then we will be doing a test to see how your body handles that, and your doctor will change the dose as needed.
Oh, then what happened if she miss that doses?
Yeah, so if you miss a dose of this medication, you want to take it as soon as you remember, but you don't want to double up on dosages, and you never want to skip any.
What are some common side effects? That's what I'm like the most worried about.
Most scared about? Okay, so the most common side effect is rash, but some others can be bruising and excessive bleeding because your blood is thinner than it would have been previously. And then this also increases your risk of bone fractures.
Well, I hear the people taking the Warfarin, they need to do the blood test. Like, how often she need to come here, or like keep doing that?
Yeah, so the blood test is called the INR, and it checks the thickness of your blood, and you should be sure to come anytime you have an appointment for that to make sure that you are getting the proper dosage and your blood is not too thin. Your doctor will talk to you about when to schedule those appointments.
Okay. Well, can I see?
Yeah, of course.
Thank you. Okay, we keep recording.
Are there any foods that I can't have?
So while you're taking warfarin, you should avoid foods high in vitamin K, like leafy green vegetables like spinach and kale, broccoli, those types of things, because Vitamin K has the opposite effect of the drug you're taking, so we just want to limit those foods that you could have in your diet. And also, you should avoid cranberry juice, grapefruit juice, and alcohol while taking this medication.
Wow, that's a lot.
That is a lot.
Yeah, that's a little bit sad. Then I cannot have really good food with you.
I know.
Well, I hear that then is able to the fall down really like more than usual. What if she fall down? Does she need to come to hospital right away?
Yeah, so while you're on this medication, it is very serious if you fall and hit your head. Even if you're not hurting, you should definitely come get it checked out because you could have internal bleeding that we don't know about. And also you should avoid hazardous activities where you're more likely to get hurt or fall down and bleed or anything like that. Do you participate in any hazardous activities?
Yeah, that might be a problem,
Yeah.
but I'll do my best to work on it.
Okay.
How do I store the pills?
So it should be stored in a tight container at room temperature, and it should be away from heat, light, moisture, those types of things. Do you have a place at home where you could store that?
I think we do.
Yeah.
Just like stick it in the cupboard or something.
And I will
Okay.
remember to remind you.
Yeah,
Good.
that'll be good.
Yeah.
I'll probably need that.
Or scriber can do that one too.
Yeah. I don't have a good time swallowing pills usually. Am I able to crush it or take it with something?
Yeah, so you're able to crush it or keep it whole, which in your case you'd probably want to crush it, and then you could even put it into some applesauce or something like that so that you don't even really know you're taking it.
Lovely.
Oh, then how long Emily have to take?
Yeah, so it depends on how serious her condition is and how effective the drug is for her. Some people will take Warfarin for a month or so, and others will be on it for most of their life. It just depends on your risk level.
Okay. Well, I hope you feel better.
I better be low risk.
Yeah.
So my birthday's coming up and we're having a party. Am I able to drink for that? Or do
wow.
I have to
How old will you be turning?
21 actually?
Wow! Okay, so it's very important that while you're on this drug that you limit your alcohol consumption because this drug thins your blood and alcohol thins your blood as well. So you might have to have a sober birthday party.
So can I just skip a dose and drink instead?
So it's not recommended to skip any doses, but it's also not recommended to have your medication, warfarin, and alcohol. So I will double check with the prescriber to see what you can do for your 21st birthday.
Okay.
Other blood thinners on the market, Xarelto and Eliquis, as well as Pradaxa, and any of those do not require the INR blood testing. And I've spoken with your physician, and I think your physician believes that warfarin is still the best option for you at this time.
Okay. So I already asked what foods I can't have.
So before we leave, she and I want to surely check that we understand or not. So you say warfarin is a help prevent new blood clog, the forming, but this sort of exceeding one, and she needed to regular INR often after she take that one. The testing. Okay.
Perfect. And do you remember what foods you should avoid in your diet?
Vitamin K containing foods, so a lot of the leafy greens.
Perfect.
And vegetables.
Yes. Yep.
And then if I have excessive bleeding or I hit my head, I have to go to the hospital because there
Yes.
could be bleeding we don't know about. And there are medications and supplements that interact with it. So I would have to call my
Wonderful.
provider before.
Yes, before starting any new supplements or over-the-counter medications.
Perfect.
Yes.
Perfect.
Okay. Yes, so that is a perfect summary. Also, I want to include that if you're having any of those signs or symptoms like the rash, the nausea, any trouble breathing or fever, please contact us right away. And you did a great job understanding. Do you have any other questions for me?
I think I'm good. Do you?
I don't know. Maybe I want to ask how can be a nurse, but maybe next time we can ask. Bye.
Bye.
You'll have to prescribe.
Oh, yes.
Oh, subscribe to our YouTube channel for more content and updates on how the Warfarin goes.
Yay.